This overview covers electrolytes dealing with their functions, deficiency symptoms, and excellent dietary sources. Electrolytes are electrically charged minerals that are crucial for activating several cell, nerve, muscle, and cardiac functions. They include calcium, phosphorus, potassium, sodium, magnesium, and chloride. Calcium. Beyond healthy bones and teeth, calcium regulates heart rhythms, nerve functions, muscle contraction, and blood clotting. Deficiencies can lead to muscle cramps, weakness, fatal cardiac rhythms, and poor appetite. Good sources of calcium include dairy, canned sardines, salmon with its bones, almonds, and leafy greens. Phosphorus. Similar to calcium, phosphorus is essential for nerve and muscle function, strong bones and teeth, and preventing fatal cardiac rhythms. Deficiency of phosphorus may result in muscle weakness, fatigue, and bone pain. Excellent sources of phosphorus include dairy, meat, fish, poultry, and seafood. Potassium. A key component of the sodium potassium ATP pump, potassium helps maintain optimal fluid levels in cells, lowering blood pressure, preventing kidney stones, and decreasing bone loss. Optimal levels reduce the risk of stroke, heart disease, and kidney disease. Most people are deficient as the daily requirement is 4,700 milligrams. Deficiency symptoms of potassium include fatigue, muscle cramps, and high blood pressure. Rich sources of potassium are potatoes, tomatoes, white beans, plain yogurt, and bananas. Sodium. Also part of the sodium potassium ATP pump, sodium is vital for nerve impulse transmission and muscle function. Sodium facilitates nutrient absorption, such as iron, calcium, and vitamin D. It aids hydration and stimulates stomach acid production. Interestingly, and contrary to what we are continuously told, low sodium can lead to water retention and increased blood pressure due to the hormone release of aldosterone, which increases blood pressure when sodium levels are low. Problems often blamed on sodium are more related to ultra processed foods due to its respective insulin response. Mineral salts like Baja Gold and Redmond Real Salt are excellent choices to replace your sodium, especially after moderate to intense exercise. Magnesium. Involved in over 400 bodily functions, magnesium is deficient in more than 50% of the population. Magnesium is known as Mother Nature's relaxer, known for lowering blood pressure, relaxing muscles, and enhancing sleep and mood. Magnesium is essential for nerve conduction, muscle contraction, optimal heart rhythm, blood sugar regulation, bone density, and hormone production such as testosterone, estrogen, and insulin. Deficiencies are linked to diabetes, heart disease, high blood pressure, and symptoms such as muscle weakness and frequent infections. Eat fruits, vegetables like legumes, nuts, and seeds for good sources of magnesium. However, supplementation around 400 milligrams a day is often recommended due to the soil depletion of magnesium. Chloride. Like sodium, chloride stimulates stomach acid production required for digestion. It constitutes 60% of salt and is primary electrolyte lost in sweat. Deficiency can cause muscle weakness, cramps, and spasms. Like sodium, Baja Gold and Redmond Real Salt are excellent sources to replace your salt after sweating, especially after moderate to intense exercise.